Good morning. I'm Governor Tim Pawlenty. Joining me this morning are area legislators as well as the mayors, as well as the superintendent of schools and public health officials, law enforcement officials, and others from the surrounding community. We just finished a meeting providing an update regarding the status of the H1N1 novel virus being confirmed in Minnesota, the first confirmed case. We had a chance to visit about the next steps in terms of the school closure, in terms of some of the steps that the community health professionals will be taking in this area and the state more broadly. And let me just start by saying this. We now have, of course, the first confirmed case of H1N1 virus in Minnesota. We know that that is a case that involves a person in this area. So the Department of Health is continuing its investigation to determine the source of that virus, as well as the field of others who may have been infected by this virus. We know from the CDC that the general infection period for this virus is 1 day before somebody experiences symptoms and approximately 7 days after they experience symptoms, for a total of 8 days or so that is the infectious period. So we want to, first of all, announce and confirm that there is the first confirmed case in Minnesota of this virus. This will now trigger a series of steps that the school and the community and the state will take in response to that development. Most notably, this will, under CDC guidelines, result in the middle school being closed for 7 days. That begins to run from the date of the confirmed or probable case, which would be yesterday, Wednesday. So the school will be closed for 7 days from yesterday. We have spoken to the superintendent. He concurs with, in fact, is making that decision. You'll hear from Superintendent Staska in just a moment. We will also be taking a number of other measures, but principally focusing on the investigation in this area to determine the source, as well as the range or array of impact in this community. We also want to again remind Minnesotans this is a situation that is a cause for concern, but it is not a cause for panic. The World Health Organization continues to raise the level of classification towards pandemic. That is a geographic term that involves the scope of the presence of the virus in various countries and various geography across the globe. But in addition to that, there's also a severity index. And in the United States, most of the cases are behaving as if, or the people who are impacted by this virus are having symptoms that are similar to seasonal flu disorder. And so it is a cause for concern, but it is not a cause for panic. Our goal here is to do everything that we can to try to contain and minimize the chances that this will spread in Minnesota. But realistically, we have to acknowledge that we should expect more cases. We will try to minimize the number of cases. We will try to do everything we can to contain the number of cases, but based on what we know about this virus, it is likely that there will be more cases. We want to remind everyone to practice good hygiene. Wash your hands as frequently as possible. If soap and water isn't available, use Purell or a similar hand sanitizer product. If you are sick, please stay home. It is going to hamper our abilities to contain and minimize the spread of this virus if Minnesotans do not follow that common sense advice. If you must go out, please avoid contained spaces if you are sick. That will help us minimize the chance of transference or transmission. We realize that that will not be a perfect option for many people, including the sick, but as much as possible, we need to encourage the perspective that if you are sick, please stay home or try to minimize your interactions with others as best as you possibly can under the circumstances that you have. I want to turn it over to Dr. Magnan, who will give us a further update on the health side. Superintendent Staska will make some comments about the school closing issue, and then we'll take your questions. Superintendent.